Chicago, a city built on resilience, shaped by struggle, and defined by its institutions, from the courts to the classrooms, from immigration offices to police departments. But what happens when the ground beneath these institutions begins to shift?
As the Trump administration redefines the role of the federal government, challenging norms around the judiciary, the impact on cities like Chicago have been deep and often divisive. In this special report, we take a closer look at how Chicago's systems and institutions are adapting, resisting, and in some cases, breaking under new federal pressures. From the Supreme Court to our own neighborhoods, this is the story of a city under scrutiny. This is Chicago under the federal lens.
Hi, and welcome to tonight's special episode of Chicago This Week. I'm Alexia Cadota-Browner.
And I'm Annalise Cornejo Garcia.
Shockwaves can be felt across college campuses right now after the Trump administration moved to ban international students from the U.S. The policy has left students scrambling and asking, what's next? I learned more about what students are saying. At elite campuses like the University of Chicago and Northwestern, international students have long been a vital part of academic life. Under the new administration, that presence is facing new challenges.
They're scared for their education and being able to continue studying here and pursuing careers here.
Certainly it's been very scary and uncertain.
Policy changes and visa crackdowns have left many students uncertain about their futures.
I have a lot of friends, of course, who are also international students who have been really scared and also upset about the fact that they're not sure if they can travel, because if they travel and go back to see their families, they're not sure if they'll be able to come back to the U.S.
I know a friend who he was going to do his postdoc here. He's since reconsidered. He's actually going to Japan to do his postdoc now.
International students account for 25% of all full-time students at Northwestern.
It's really cool to get to meet people from so many different places. That's always been, in my mind, a huge part of the college experience.
You get to learn about different ways of life in a way that you never could if this was just U.S. students.
On the South Side, international students at UChicago come from over 100 countries and comprise 24% of the university's student population.
I've been able to do so many things here. I've been able to meet so many amazing people. I've been able to have so many amazing opportunities, whether that's with research or internships or just in-class experiences.
Although classes have let out for the school year, the Office of International Affairs will continue to host events and webinars to keep students informed. Back in Evanston, where classes are almost done for the year, funding cuts have also negatively impacted international students' plans.
A lot of PhDs, the reason they want to do PhDs is that they want to go do more research in the future. So that was what I was originally planning as well. But then, because of all the uncertainty, I've kind of had to switch my thinking a little bit, potentially switch career paths.
Thanks, Alexia. Since Inauguration Day, Chicago has once again emerged as a center of political activism, this time in response to the Trump administration's actions. From a day of economic blackout in February to the hands-off protests in April and May Day march, demonstrators are demanding justice and calling out the Trump administration for what they call an attack on civil rights and democracy. But not everyone feels safe raising their voice right now. Chicago's Cinco de Mayo parade was canceled this year in response to fears of ICE raids. The parade was slated to take place in Pilsen, a predominantly Hispanic and Latino neighborhood in the city. In Pilsen, the need for resources is urgent and growing, but help is rolling in, literally. A mobile health team is hitting the streets of Pilsen to bring medical care to migrants newly arrived in Chicago. I was there to take you inside the frontline effort.
A young man who had just come from Venezuela who showed us a bullet wound in his abdomen.
We see patients that I saw a year and a half ago in a police station, and now they're just here for a pap smear.
He was in an accident when he was 2, and he needs esophageal reconstruction, so he doesn't ever remember eating by mouth.
These are just some of the stories heard here at a Southside health clinic.
Definitely the greatest honor of my career.
Many who help operate the clinic are part of a team of medical students recruited by founder Sarah Izquierdo in 2023. Originally, the group traveled to police stations where newly arrived immigrants and those seeking asylum were housed after being bused from Texas.
Well over 100 people that are always willing at the drop of a hat to help out and offer what they can.
Over 80 members and hundreds of migrants treated later, the team found a more permanent home in patients on Saturdays.
The crisis level pace has slowed down.
They see all ages, free of charge and regardless of insurance coverage.
We see ourselves as a really great first opportunity to get connected with the healthcare system in a place where people know and already trust us.
Volunteers offer treatments similar to those provided at primary care facilities. These could include prescriptions for diabetes, reproductive health screenings, and more. Team members say recent fears about immigration raids are decreasing the number of patients they see at the clinic.
When there's a lot of ICE activity like there was yesterday, today is slow because people are scared to go outside.
Secretary of the Department of Homeland Security, Kristi Noem, says increasing raids in sanctuary cities is a necessary strategy to protect the nation's borders.
But there are massive raids all over Chicago and the
Various social media posts alerting Chicagoans of immigration authorities spotted throughout the city continue mitigating fears.
This video. First off,
Clinic on legal and procedural protocol should they be approached by immigration agents.
I know that if we were, that I feel like our patient.
In Pilsen, Annalise Cornejo Garcia. Chicago This Week. Chicago This Week.
Thanks, Annalise. Here to talk to us about environmental regulations is our Amanda Perkowski.
After Chicago's air quality was ranked among the worst in the country, a new move out of Washington is raising eyebrows and concerns. President Trump has officially rolled back a series of environmental protections, scaling back EPA rules aimed at limiting pollution from factories, power plants, and vehicles. The administration says it's about cutting red tape and boosting the economy, but critics warn Chicago could pay the price in public health. The rollback comes just weeks after Chicago was named one of the most polluted cities in the U.S. With hazy skies and elevated ozone levels, from the south side to Little Village, neighborhoods already burdened by pollution could now face even more harmful emissions. And with climate change fueling longer wildfire seasons, experts say we're entering dangerous territory. Now let's go back to the desk.
Thanks, Amanda. After the break, we take a deep dive into Trump's economic policies, from tariffs to cuts at the Department of Veterans Affairs. Stay with us.
I'm Kelly McEvers, founding host of the NPR podcast Embedded.
I'm James Edwards, host of the Unresolved podcast from Frontline.
I'm Antonia Cereijido, former senior producer of Anything for Selena podcast and current executive producer at Elias Studios.
My narrative, since I've been locked up and kind of made my transition, has been like redemption, accountability.
When I come into the classroom environment, every individual that sits amongst me takes education seriously.
My relationship with Giannis is unique. We're from the same country, we're from the same city. Being a Northwestern alum, I think, has tremendous advantages in the sports industry. To me, that community, it's been with me for 20 plus years.
A major shakeup in vaccine guidance is drawing sharp reaction from the medical community. Health and Human Services Secretary Robert F. Kennedy Jr. announced a controversial change at the CDC regarding COVID vaccines, sparking resignations at the agency. And our Riley Cook has more.
Standing alongside top federal health leaders, Robert F. Kennedy Jr. announces a major change in vaccine guidance.
As of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
But those groups are still included on the CDC's website. That discrepancy causing confusion and concern among Chicago physicians like Dr. Mark Sala, a Northwestern pulmonologist. He fears conflicting messages could further muddy public trust.
Now the messaging is unfortunately quite confusing and contradictory for the average person, but I think a discussion with your doctor in a meaningful way who you trust is always going to be the foundation.
It comes as a new COVID variant, NB181, sweeps through China. The first handful of U.S. cases reported on the West Coast.
You wouldn't offhand have any reason to assume that this has become more virulent and causing more issues than the last variant.
Some doctors say the bigger problem isn't the variant itself, it's actually accessibility. Without CDC recommendations, some insurers may stop covering the shot, which means that cost will be shifted onto consumers. So if you're under 65 and healthy, you could end up paying $200 to get vaccinated.
Let's say they still want to get vaccinated. Can they? So if they walk into a Walgreens or a CVS and say, hey, I'm still interested in getting the vaccine, do you stock it? Can I get it? And then do I have to pay out of pocket or not for it? So all that is still entirely up in the air.
That's because the CDC's immunization schedule determines insurance coverage for most private plans and Medicaid expansion programs. In a statement, health insurance industry group AHIP says, quote, health plans are closely reviewing these latest guidelines. At this point, they have not changed their coverage related to COVID vaccines and expect to cover these vaccines with no cost share. Still, NIH and FDA leaders say repeat boosters are no longer necessary.
Most countries have stopped recommending it for children.
Still, Dr. Mark Sala says the benefit is there, especially for high-risk groups.
I think the data are clear about the benefit in children and pregnant women, if for nothing else, for prevention of severe symptoms and long COVID.
With a new variant emerging and mixed political messaging, local doctors say it's best to trust your personal physician.
It's always a conversation with your doctor because that's who knows your health history the best.
Reporting from Lincoln Park, I'm Riley Cook, Chicago This Week.
Thanks, Riley. More changes in Washington ripple far beyond the Capitol. Recent shifts in federal healthcare funding are already being felt at Northwestern Memorial Hospital here in Chicago. Our Peggy Hellman has more on how the hospital and its patients are navigating the changes.
At the heart of Chicago's medical district, Northwestern Memorial Hospital is confronting a growing storm, one brewing not inside its walls, but in Washington. Since January 20th, President Trump has signed into effect hundreds of executive orders freezing funding at the National Institutes of Health and National Science Foundation. Here at Northwestern Memorial Hospital, doctors and researchers are already feeling the impact of these changes.
It's very devastating. It's devastating to a lot of researchers.
While federal judges were able to extend a pause on NIH cuts, the Trump administration proceeded to freeze $790 million in federal funding for the university, according to an email from University President Michael Schill. Patients are also feeling the pain as the Trump administration looks to advance a massive bill that would make cuts to Medicaid. According to the Illinois Department of Health Care and Family Services, this could leave nearly 4 million in the state without health insurance. Public Health Institute of Metropolitan Chicago CEO Karen Rytan says the consequences of these policies will cost lives.
Then people will die and get sick, and there will be a lot of consequences that will cost more in terms of both money and lives in end.
Despite the work of outside organizations, lost federal funding leaves an unfillable gap.
But I will tell you that there is no nonprofit or city or state government or philanthropic organization that can make up for the loss of billions of dollars in federal money for public health.
For a hospital ranked among the nation's best, these challenges pose not only financial and logistical hurdles, but a real threat to the patients and research breakthroughs that depend on it. At Northwestern Memorial Hospital, I'm Peggy Hellman, Chicago This Week.
Thanks, Peggy. Speaking of funding, President Trump's tariffs are hitting home here in the city. From factories and freight yards to mom and pop shops, businesses are feeling the squeeze as policies are paused and resumed. Our Simone Roberts spoke with local businesses to learn more about how they're moving forward.
While the Trump administration has placed a 90-day pause on all tariffs, local businesses are still feeling the effects of higher prices on imported goods. But a lot of business owners are making the executive decision to keep their prices the same for their customer base.
For many small businesses here in Chicago, the price tags are going up, and not just for customers. Tariffs on imported goods and materials are hitting business owners where it hurts, their bottom line.
Aluminum to-go container you see everywhere went from $70 a case last November to over $115.
For local businesses, tariffs aren't just a policy debate, they're a daily challenge. And with uncertainty around future trade deals, many say they're preparing for the long haul.
I also need to look at what my competitors are doing. Most of them have not increased the price, and I am afraid to increase the price by turning away my customers.
And while last month the U.S. lowered tariffs on China from 145% to 30%, there will still be a 10% tax on almost all goods despite the 90-day pause, according to the BBC.
Companies, they say some countries between like 10 to 40%. They're talking about China is going to be the highest. For us, in our place, that doesn't hurt us.
Companies have begun to warn their buyers of future price increases due to the fluctuating tariffs around the world.
Now the companies, they said not just the tariff, they said the price is up just because of some other reasons, you know, especially coffee. So we are, they said short. The chocolate, the same thing is up.
Businesses aren't the only ones feeling the fluctuating economy. Some Chicagoans are feeling it in major rent increases.
And I looked at my insurance on our condo here in Chicago, and I noticed, okay, this is $370 from $320. I didn't even know there was sticker shock in the moment.
Not all businesses are feeling the tariffs the exact same way, but all businesses here in Chicago are adjusting their prices, and some are even adjusting their hours to make up for the price increase that tariffs have placed on their businesses. In Andersonville, Simone Roberts, Chicago This Week.
Thanks, Simone. Another bill in Trump's proposed economic policy, Trump accounts for every child born in the U.S. during Trump's second term. Taking a closer look at the proposed bill is our Amanda Perkowski.
Hi, Alexia. Another federal bill making its way through Congress, the Big Beautiful Bill, includes a provision for Trump accounts. If it passes the Senate, this bill will affect Chicagoans, especially those who are expecting or have young children.
As currently written, the Big Beautiful Bill would provide $1,000 savings accounts to all babies born between January 1st, 2025 and December 31st, 2028. But parental opinions differ on the bill.
It's a good initiative, particularly for the cause it's being, that it can only be into education and housing purposes. That would definitely help the children when they grow up.
Theoretically, I think investing in children, having government benefits for investment in children is a great idea. So that part I like. What I don't like is I think the amount is too low. And so I'm not sure that it would make a meaningful difference for as many families as it needs to.
Experts also have concerns about the initial starting amount.
Between 18 and 30 years from now, there's going to be inflation that's going to lower the value of the investment over time. So again, like, is $1,000 now at birth going to be enough to really do the things that the accounts are intended to do for families?
Taking a lump sum of cash and parking it and never touching it again. We think about what the growth rate would be on that. And let's say if we take a generous 4% on growth, with $1,000 contribution over an 18-year window, the math isn't going to move us that much farther from our origination point.
To grow the Trump account, families are allowed to invest an additional $5,000 per year until the child turns 18.
For families that do have wealth, that have $5,000, which was the max to contribute, they've already had a position that they can allow these funds to be moved into a space of investment. Families that don't have that capability would just ultimately have $1,000 deposit. So at the end of that 18-year window, we really don't have much more money because we do need to fund investments over time to get the value.
Despite the funds not generating as much as other forms of investments, experts still agree that beginning to invest is a step in the right direction.
We consume too much. 70% of our GDP, 70% of our economy is consumption, consumer spending. And we don't invest and save enough. And so I think these plans, anything that can get a broader swath of the American population to invest and save more is a good thing.
Giving people access to investment opportunities is a good thing, but not equipping them with knowledge on what to do with them or how to make the best use of them or what the penalties are if you don't use it. There are going to be some families who are going to say that penalty is not high enough to deter me from taking it out early or use it for something else. And that's because everyone faces a situation where they have an emergency expense.
But if people are able to hold out for even more than 18 years, the power of compounding can be substantial.
Milken Institute had some numbers that blew my mind that if you kept it for 60 years, so you're a 60-year-old, and you didn't do anything, you just sat there and said, I'm not touching this, they grew to over $500,000.
For now, the bill remains in limbo, awaiting a vote in the Senate and leaving families watching closely. In the Loop, Amanda Perkowski, Chicago This Week.
Thanks, Amanda. Up next, an exclusive interview with Senator Bill Cunningham on cuts at the VA. We'll be back after the break.
My relationship with Giannis is unique. We're from the same country, we're from the same city. Being a Northwestern alum, I think, has tremendous advantages in the sports industry. To me, that community, it's been with me for 20 plus years.
Big cuts at the VA made in March are causing frustration among veterans months later as it becomes more difficult for those who serve to receive care. Our Katie Lacavara reports from the Jesse Brown VA Medical Center. Katie, tell us more.
The Jesse Brown VA serves approximately 62,000 veterans. Although federal cuts aimed at improving efficiency have many worried about the effects on veteran care.
In response to President Trump's Department of Government Efficiency and Workforce Optimization initiative, VA is conducting a department-wide review of its organization, operations, and structure.
In March, the Department of Veteran Affairs announced it would remove over 80,000 jobs, cutting its workforce by 15%. While the cuts are aimed at improving efficiency, many are concerned that it will have an impact on veteran care.
We don't work off of numbers. We work off of patients. So when I heard a blanket number of 80,000, like many of my teammates, we were kind of in disbelief.
Cook County is home to over 130,000 veterans and 2 VA medical centers.
But this is the proof. What are we willing to do?
And since the cuts were announced, union nurses in Chicago have held protests, citing their fears that the job cuts could affect their patients' care.
How it's affecting the nurses that are in the union is that there's sort of this fear of retaliation if you speak out about staffing ratios, if you say we don't have enough nurses to deliver care. So I think it cuts deeper for union nurses because of that fear.
The VA has insisted that cuts won't affect veterans and will only help the department work better.
Let them hear it straight from me. Quit reading what may be. Quit reading what might be.
If we can focus on that efficiency and deliver veteran first and veteran-centric results, that'll ultimately be a good thing. It will have pains and there will be challenges. Ultimately, if we can deliver those benefits in a veteran-centric, veteran-facing way, I think we'll be fulfilling the promise in a much better way.
Although veterans in Chicago's 19th ward are already feeling the effects.
I was approached from the VA a year and a half ago to say, hey,
we see you have a high volume of veterans in your community. There was a lot of services provided, and it was everything from veterans in their 30s all the way up to veterans in their 80s. When we were notified that the VA was going to have to cut the outreach because of the federal budget cuts, and all I said to each one of them as they walked out was, I'm going to keep fighting.
From the Jesse Brown VA Medical Center, Katie Lacavara, Chicago This Week.
Thanks, Katie. Here to tell us more about how veteran services are affected is Illinois Senator Bill Cunningham. Thank you so much for speaking with us, Senator. Veterans are voicing their concerns as the Trump administration is making these cuts to the VA. What's your response?
That's really a shame that the people who stepped up and were willing to literally fight for our country now are denied those kind of benefits. Just doesn't make a lot of sense. It's really upsetting.
How are you working to fill the gaps?
One of the first things we did to react to this was set up a services fair, veteran services fair in the community where we had all sorts of groups, whether they're employers or healthcare providers, that would come forward and set up booths at the event and do what had been being done in our office, and that is sit down, talk to the veterans, and put them in touch with the help that they needed.
You mentioned local organizations shouldering the brunt of some of these changes. Have you noticed any changes at the state level?
So the state has a Veterans Affairs department, and we provide a lot of services for veterans, including the veterans' homes. The state runs several homes for veterans for their sick and elderly at no cost to the veterans. And that work continues. The work where there's kind of a gap is for people, who are younger. I think there's, some sort of misconception that a lot of people have that veterans are older, they're elderly, and there's certainly that veteran population. But what we have and what we're dealing with now are veterans from the conflicts in Iraq and Afghanistan who are much younger than that and who are really suffering. And they just need help to get through their daily lives and get to work every day, support a family. They're really in the middle of their lives right now. And we unfortunately have a gap there that, as I said, most of the state services are sort of geared towards, later in life services. So that has us scrambling. As I said, we're doing the best we can, but we're basically doing it by triage.
Thanks so much, Senator Cunningham.
Thanks, Annalise. In Springfield, lawmakers seek to extend press protections in a new bill. Our Riley Cook brings us more.
In response to a recent ruling by the Illinois Supreme Court that allowed a defamation lawsuit against the Chicago Sun-Times to proceed, lawmakers are stepping in to strengthen legal protections for journalists. Senate Bill 1181 is headed to Governor J.B. Pritzker's desk. The bill aims to expand legal shields against slap lawsuits, often used to intimidate or silence reporting. It also clarifies that reporting on matters of public concern counts as participation in government. Despite some concern from lawmakers that the legislation could encourage, quote, irresponsible journalism, the bill passed both chambers. Back to you.
Thanks, Riley, and thanks so much for watching tonight's episode of Chicago This Week. Signing off, I'm Alexia Cadota-Browner.
And I'm Annalise Cornejo Garcia. Have a great night, everyone.
Hi, thank you so much for supporting our work at Chicago This Week. As we close this chapter, we want to take a moment to acknowledge the reality our industry is facing. The essential news, services, and life-saving information journalists share with the American public are currently under threat at the federal level. Here in our newsroom, we will challenge these threats by continuing to write boldly and tell the truth fearlessly, because a free press and an informed public are vital parts of a healthy and functional democracy. Thank you so much for tuning into our show, and take care, everyone.